The care needs that our clients have don't change in the time of a pandemic. And on one hand, they're actually increasing when you talk about folks who have COVID-19 and can receive care in their homes. But so our top priority is really being able to have continuity of those services and still providing those needed services to our clients, but doing it in a way that we can protect both the employees and everyone that we serve. So the pace has probably slowed down just a little bit during those visits because we're paying attention a lot to personal protective equipment. So from the very beginning, we've been following CDC guidelines for personal protective equipment like face masks and face shields for our employees. If they're providing services to folks who have COVID-19, then we might have more PPE like gowns and gloves. Hand washing, thorough, hand hygiene has always been really important. We've just kind of doubled down on some of those guidelines, done some additional teaching just so that people, in a time where there's so many things that are changing very rapidly, all of our employees feel very comfortable with what they're supposed to do. So we have some measures in place where they're putting on personal protective equipment outside the home, for example, before they enter. Monitoring, reporting any symptoms, certainly staying home when they're sick, and then doing screening for our clients too prior to that visit. So at any time, if we can do that from a distance before we arrive, or through a barrier when we get to the home so that we can try and keep everyone safe. And just make sure that we're screening them for any symptoms or also any potential exposures that they might have had. We want to make sure that we can still provide the services to our clients whether they have COVID-19 or not. And in order to do that, our employees have to keep themselves safe with all of that personal protective equipment, all of those standard infection control procedures that we had before, but we're paying really close attention to now. And then we want to make sure that we are not bringing any potential exposure to our clients in their own home. Want to make sure that they still feel safe and secure in their home setting and that we're allowing them truly to stay there longer and be more safe there than they would be if they were going out to an outpatient setting.